recording of the event. If you have any questions or any technical issues, just use the Q&A box and let us know. One thing I did want to tell everyone is that we really do want to make this interactive. We want your questions. Our panelists want to hear from you. And we don't want to just save it to the very end. So as you have questions throughout the conversation, type them into that Q&A box. We'll try to get to as many as we can, weave them into the conversation, and dedicate a little time at the end as well to answering them. So hopefully most people have joined by now. My name's Adva Saldinger. I'm an associate editor here at Devex, and write a lot about these issues around innovative finance. And so I'm really looking forward to and excited about our conversation today about accelerating impact and sort of where things stand in the field of outcomes financing, particularly as we look at the impacts of COVID-19 and the response moving forward. I think we all know the sort of breadth of, the health and economic consequences of COVID-19. And as we look to the recovery, we know that there's going to be increasing financial pressures as there's more and more demand for financing, more and more need. And so I think it's a really interesting moment to look at how these outcome-based financing tools, how innovative finance can really help us, help the development community look to solve some of those challenges. And so that's what we're here to sort of talk about today. We've have a great group of experts who spend a lot of time thinking about this to share their insights with us. I want to thank the UBS Optimus Foundation for partnering with us on this event and helping make it possible. Here at Devex, we're doing a lot this week, and you can find out more at unga75.devex.com. And please tweet along with us during this conversation using hashtag unga75, hashtag social finance. And as I said before, please share your questions throughout in that Q&A box. And now it's really my pleasure to introduce Charlotte Petrie-Gornitska, who's the Deputy Executive Director of UNICEF, who's going to share with us some opening remarks. Charlotte, I know you spend a lot of time thinking about these issues. I know we've had some great conversations about some of these issues. So please kick us off.
Thank you so much. And thank you for putting children at heart of innovative financing. It's really an honor to be here. So, well, as COVID-19 continues to spread, the international development community is being rocked with crisis. The global South, with the lowest indicators for human development and socio-political instability and conflict, bears a disproportionate share of the burden of key child rights deprivations. And UNICEF, we're on the ground before, during and after an emergency, and COVID-19 is no exception. And now we need more support than ever to reimagine and build back, and some say even build back better, let's hope so, a better world where children can really fulfill their rights and the potential. Because children also continue to be disproportionately impacted by COVID-19. We didn't see that to start with because we watched the virus, how that affected, but we have learned so much more. The pandemic has disrupted everything that we know is so critical for children's social, physical, mental, and emotional development, learning, and their well-being. And the pandemic exacerbates the challenges also to achieving the 17 Sustainable Development Goals. We must not shy away or move away from that agenda. There is an urgent need for a shared framework for ending poverty, reducing inequality, while protecting our planet, tackling climate change, and spurring economic growth. Sources of funds to meet the SDGs will mainly come from two channels, and you would know them: public finance and private capital. And with 10 years left to achieve the SDGs, the international community must think more creatively about the mobilization of capital. And we at UNICEF, we look at this through the lens of children, where we see more than 5 million children still dying each year, with more than 12,000 killed or maimed in armed conflict. We see 80 million children annually in need of humanitarian assistance. We see over 260 million children and young people out of school. And 650 million girls and women alive today were married before their 18th birthday. And as you so well know, at the heart of the problem is a 2.5 trillion annual funding gap, a significant lack of investments dedicated to sustainability, linked to a low level of private sector participation. What is stopping private sector participation? This has been the main topic of debate among development finance experts ever since the adoption of the billions to trillions vision in 2015. And I have been part of that. And I believe governments have a key role to play in enabling new innovative financial mechanisms, such as impact bonds, to be tested and to be scaled. And by moving away from a funding approach, relying mainly on ODA, which will be even more important, we need to move to a financing paradigm for development. The public and the private sectors can jointly develop a holistic model where all public, private, domestic, and international financial sources come together, and where returns seeking capital is part of the funding mix. The barriers that must be addressed to unlock capital for sustainable development are, though, not just financial. They are mainly systemic and behavioral, and the actors best suited to overcome them are countries and their national level institutions. Governments need to establish national sustainable priorities and plans. They need to establish national strategic financial plans, and they need to tap in strategically and mobilize private capital by aligning the allocation processes to the SDGs in all sectors, including infrastructure as we know it, health, education, energy, technology, etc. And we at a large organization like UNICEF, we need to think through how best we can support this change, but also how we need to change ourselves to reflect this new reality. So we need to be right in the center of the debate, if you will, catalyzing new partnerships, bringing together different kinds of capital, negotiating between different risk appetites, and above all, engineer public-private partnerships at scale. While no single model or single actor will solve the sustainable development financing conundrum, we see value in exploring all innovative financing opportunities that can deliver results for children. And that includes working with partners to develop development impact bonds, which offer new efficiencies and is attracting new forms of capital, and aligning incentives of all actors involved around results for children. Finally, and this speaks to why so many of us are here today, there is a growing market for these types of investments. We saw it before COVID. We haven't seen a decrease in that increase of growth. And while one development investment bank may not solve this issue alone, but if we can get social investors to take on risk, contribute to robust results, and encourage broader government reforms, then we can attract other funding and financing. We can accelerate achievements of the Sustainable Development Goals. So onwards, upwards, on we go. And I'm looking forward to take part of the discussion going forward. So thank you, and over to you, Adva.
Thank you so much. And before I introduce our panelists who we're going to hear from next, I wanted to have you all participate in a poll. just to get a sense of the room. So my producer is going to put a poll up on the screen. It should pop up for all of you. There it is. So please go ahead and answer that. And I will introduce our wonderful panelists. We have Dia Martin, who's the Managing Director of the Social Enterprise Finance Team at the U.S. Development Finance Corporation. We have Maitreyi Bordia Das, who's the Manager of the Global Partnership for Results-Based Financing and Manager of Global Programs for Urban Disaster Risk Management, Resilience, Land, Global Practice at the World Bank. It's a mouthful. We have Avnish Gungadudas, who I probably butchered your name, Avnish. I'm really sorry. I've known you long enough. I shouldn't do that. Who's the co-founder and managing director at Instiglio. And we have Maya Zisweiler, who's the executive director of programs and social finance at the UBS Optimus Foundation. So maybe we can go to our poll results, and that'll help us kick off our conversation. Hopefully you all had a chance to answer. So our poll was, how could outcomes-based financing support the COVID-19 recovery? And the majority of you believe that ensuring private capital is directed towards high-impact projects is sort of the key aspect that it can help with, though making a case for mainstreaming, certainly pretty high up there with 31%, though not as many of you believe that it can mobilize more funds. So that's interesting. We'll get into some of those issues now as we start our conversation. I really wanted to open it up to our panelists to share their thoughts about how COVID-19 has impacted the outcomes-based financing space. And Maya, maybe we'll start with you. UBS has been a clear leader in this space, and I know that you're, supporting active DIBs and projects that are trying to continue operations on the ground at this time. So I'm curious to hear a little bit about how you've had to adapt and operationally how COVID is impacting some of the sort of existing outcomes-based financing models.
Sure, thank you, Ava, and hi, everybody. So I guess we've had to deal with it in like 3 different ways, and I'll start with program adaptation. That's really been the one aspect that really COVID has forced us to rethink. And I'll take maybe 2 examples of impact bonds that are live right now. One is the Utkrishta Maternal and Newborn Health Impact Bond that aims to improve quality standards for small hospitals. And so in that program, because of the lockdowns in India, basically we've had to shift to virtual training of the hospitals. We've also, the service providers have implemented telemedicine so that the patients, the pregnant mothers, don't actually have to go to the hospitals, but can do that virtually. The other interesting innovation was one around actual evaluation. So even the evaluator wasn't able to go to the hospitals to conduct that and to look whether the results were being achieved. So we shifted to remote evaluations and worked very closely with the government endorsed accreditation schemes to be able to implement that. So that's one example in the health space. Maybe another one in the education space, where basically schools have been closed in India since March or April. So the teams have had to completely rethink how they can actually reach those children, make sure that they support their well-being and make sure that they're learning. So it's gone from, let's say, high-tech innovations with content on smartphones, but obviously smartphones, very low penetrations in the areas that we operate in. So we've looked at more low-tech solutions, so phone, SMS, and then no tech solutions. So leveraging the strong relationships that we have within the communities to look at community engagement, parental engagement, and then door-to-door visits in smaller groups using social distancing. So that's kind of on the program side, and that's been critical. The other piece I think that's affected outcomes-based funding is obviously the contract itself. Can we actually reach those outcomes now that that program delivery has been compromised? And so really renegotiating those targets to make sure that we're still incentivizing our program partners to make sure that children are learning, that quality improvements are improved, but thinking about it in a more realistic way. And that's a lot around coordination and collaboration with all the stakeholders involved. And then lastly, I'll just say that for the programs that are not currently in implementation, so thinking a little bit forward, the ones that are in design or that were close to being launched, you know, because of the budgetary constraints of some of the donors or government, we've experienced some delays, and in some cases some decreases in funding, and so I think there it's really trying to work with those donors to see what is possible in the short term and then more in the medium and long term. I'll stop there. Those were some initial thoughts.
That was great. Thanks, Maya. Avnish, maybe I'll go to you next and get your thoughts on sort of a similar question. I know obviously you guys are doing both development, but also think a lot about the evaluation aspects. I'm curious what you've seen, what impacts you've seen, how it's impacting your work.
Yeah, thank you, Adva, and thanks for putting together this great panel. So of course, like we've seen, you know, along Maya's line of thinking and what she was saying, various program adaptations, and we have to kind of keep in mind that COVID has most severely affected the populations that we tend to work with. You know, whether these are unemployed youth who are now, you know, in much greater numbers, or ultra poor families in Kenya. These are the populations that are the most affected by this crisis. So I think, you know, we've taken two lines of thinking, and this whole change has meant that, of course, results are much harder to achieve, but also has meant that results more than ever we need to achieve them, right? So most of the adaptations that we've tried to engineer in our projects have been around, you know, serving better and serving differently the populations that we're trying to reach, right? So, for example, recognizing the crisis in Colombia, one of our social impact bonds here is working with unemployed youth, and we had this feature in the design where we had two types of contracts. So let's just say, for simplicity, one was a lower quality contract and one was a higher quality contract that these unemployed youths were being placed into, and that's the result that we're hoping to achieve in this project. And initially, the design had a cap, so you could only have 20% of the contracts be of lower quality. But when you recognize that 25% of the youth is unemployed right now, and the quickest entry point for this population into the labor market is actually through these lower quality contracts, we recognize that serving this population better meant lifting that limitation and allowing the providers to actually go towards the hardest to serve population. So always having in mind, you know, adaptations that actually continue serving in a different environment. Similarly, that was the case in Kenya, where we had a restriction on the provider not being able to give cash transfers to the population, but this restriction was also lifted because we recognized that cash transfer is actually extremely important for reducing poverty in this kind of environment. So I think there's a bunch of adaptations like that we made in project results, in outcomes, to adapt to the new realities that all our projects are facing, and most importantly, to adapt to the new realities of the beneficiaries themselves. And then there's a second type of adaptation, which I think is more around recognizing that with this crisis, there has been a complete shift in the risk profile of these transactions, and much more risk has gone towards the providers and investors. So there's often an effort to redistribute and reshare that risk in a way that's fairer. And that's also a type of adaptations that we've seen in all the projects that we work in. And then there's, you know, like beyond adapting the existing projects, there's also been kind of new efforts and new lines of work that have emerged in a crisis response. So one line of work is the demand for innovation, and to find innovation in a way that's results oriented and that's efficient. And I think results-based finance has an answer to that. We've, for example, launched, helped the IDB and the Swiss Development Corporation launch a challenge fund here in Colombia that's entirely based on results. It's about sourcing the best sort of employment services in the country to respond to the crisis of employment we're already having here in the country, and recognizing that this environment offers an opportunity to think very differently around you know, service delivery. For example, employment services are known to be face-to-face, very hard to scale operationally and financially. And now with COVID, there's a strong urge to go towards digital means and methods. And we're using outcomes-based financing to efficiently source the most cost-effective innovations that are going to address the scale of the crisis that we're facing. So I think there's been some urge towards innovation-based approaches. And then there's the second sort of type of outcomes-based approach that we're seeing greater demand for, which is performance management of public resources, precisely because governments are being pressured in an unprecedented manner, I think, to deliver results in a very transparent manner. So with limited resources and more needs to address, there's definitely a need for greater and more sophisticated performance management. So we've seen various governments in Morocco and Colombia here. We're working with the presidency to put in place a performance management system that tells them which policies are truly working, brings real-time information to decision-making. So that's a second type of efforts that we've seen in the response to COVID. So yeah, those are some of the adaptations that we're seeing in our work.
Thanks. Maitreyi, I'm curious from your position. I know that you'd been working on sort of looking at more outcomes-based tools, and I'm curious what you've seen in terms of any negative impact, slowdown in the interest in the development of these tools as a result of COVID.
So thank you. And again, a real pleasure to be here. I first of all want to agree with everything that Maya and Avnish have said, because everything that they're seeing, we're seeing as well. In terms of the slowdown, not a slowdown necessarily in the demand for the tools, but there are three ways in which the pandemic has hit everything, but particularly outcomes-based financing. The delays, for one thing. And the delays mean that, contracts either need to be renegotiated, or they need to be extended, or they need to be a different set of targets needs to be set. So we're seeing a lot in terms of delays, in terms of school closures, in terms of health facilities moving in different directions. So for instance, in Cameroon, the World Bank is part of a large group of partners that supports the kangaroo mother care. And there as well, we are seeing that health facilities are actually moving towards much more COVID response. And so we're seeing there's a likelihood that things like newborn care may suffer as a result of that. We're not necessarily seeing a reduced demand for the tools per se, but I think people are so caught unawares that they are unable to really articulate ways in which that contract will then need to be either renegotiated or changed or whatever. Let me give you another example. We recently signed a grant agreement in Ghana, an education outcomes impact bond, and it's part of a larger education project that the World Bank supports. So it's an additional financing to that. Now, just as that grant agreement was being signed, COVID hit. And so what that allowed then was for a lot of tweaks to be made in the design itself. So for instance, contractors being asked to put in contingency clauses, because this is, every risk section in your project document is now playing out. This is the ultimate risk. So what kind of contingency clauses? There's also a possibility that some of these contracts may be allowed to move away from outcomes to more outputs. So for instance, if it's a water project, rather than thinking in terms of the effect on diarrheal disease, you talk in terms of connections, water connections. So there are those changes that are being contemplated. But the most important thing we're learning is that flexibility in design at the beginning is going to be key to the way these contracts are going to be implemented as they go forward. We are also seeing, and I took the opportunity, there are so many people that have worked in this panel on the India DIBs. I took the opportunity to go back to some of my old contacts, and actually I had a great call with the Educate Girls team. Many of you have been involved in that, and that closed a few years ago. but I was trying to understand from them, what are the next steps? What's going on in Bhilwara? What's going on in this place where the impact bond actually took place? And essentially everyone is going into COVID response. And much in the way that Maya is saying is they're going into more digital responses. But what we are finding is that kids are having to use their parents' smartphones. Very often there's just one smartphone in the, even if there is data, that I think this issue of equity and of broad inequality in access to digital infrastructure and in access to good internet is going to be central to everything, whether it is results monitoring, whether it's independent verification, whether it's telemedicine, whether it is schools. So we are finding that the biggest challenge that our partners on the ground are facing is to be able to give children independent, even if it's just smartphones, that every child should have one, because they can't actually share the one smartphone when 3 kids are going to school on that one smartphone. That's one of the biggest challenges that that I was talking to these people about. So yeah, those are the broad category of challenges. In terms of adaptation, what we are finding is that pretty much all project teams are in the thick of COVID response. So for instance, in Uzbekistan, schools are closed. So what are the project management units going to do? The project management units are actually struggling to stay up just to be able to function themselves. And I think that there is a bit of the way in which the pandemic has actually hit people they're adapting on ongoing on a daily basis. And I guess what I'm trying to say is they're not necessarily thinking very far about what this is going to mean for their impact bond per se. I think they're taking a holistic picture of their current environment and they're responding in the best way that they know how. Let me stop there, and then I have a couple of other things, but I'll come to it later.
Great. Dia, I want to go to you. I know that the DFC has participated in some of these mechanisms, but I know that they're also often very complex to put together. And I know that you guys have been thinking about how some of these instruments could be streamlined a little bit. So I'd love to hear from you both about, how this is impacting your work, but how you're thinking about this issue of streamlining as well.
Thank you. First, I'd just like to say thanks for the opportunity to participate on the panel. It's a great way to learn more from other panelists and speakers. And I think it's very important to us at the DFC. We really seek to be innovative and impactful in the financing that we provide. And we see ourselves as that bridge to mobilize or bring in private sector capital. And one of the things that we're really excited about in participating in DIBS is that it's a real way to tie the social impact and outcomes to the investment and to tie it directly. So it's our goal, and we're quite bullish about participating in new DIBS as they launch and as they come onto the market. I think for us, what we found, first, I'll speak more broadly and then speak more specifically to COVID. What we found that has been challenging for us, or what we'd like to look at for DIBS, is the idea of scalability. In our opinion, one of the things that we want to do is we want to, being that bridge, deploy funding, perhaps earlier, smaller amounts, but the idea is to be able to deploy larger amounts of funding to, in fact, tackle some of these developmental challenges. So one of the things that comes to mind for us as we evaluate DIBS are what are the size of the DIBS and what does that mean for the impact that they would have? And are the DIBS structured in a way that they're flexible enough to scale in the future? And this is especially important as we look at another point from the investor perspective, which is complexity. And what we found with DIBS, there are a number of different parties. You look at the service delivery and the outcome funders. And looking at that and the complexity of having more partners within the individual transaction, how do you streamline it to meet each party's objective and to actually be able to come up with realistic parameters that are able to be tracked and measured for the delivery of the outcomes in the DIBS. So I think that's really important for us, as well as looking at being able to replicate. I think for us, one of the things that we're aware of is a lot of the challenges that we're seeking to solve, and the DIBs are very bespoke and unique to a particular geography or a market or situation. And we are looking at ways to structure the DIBs so that they're more flexible, so that they can address maybe that particular challenge, but we can also use that same structure for another geography or another environment. So that's something that's really important or meaningful to us. And then the way we look at that in the context of COVID is just what a lot of the other panelists have said, looking at the flexibility in the program delivery model. Is it a model that can adjust to the challenges that are created by COVID? And is the team able to adjust? And honestly, as an investor, how can we support that adjustment? Because it's our joint interest for these projects to be successful. So looking at that a bit more. I think the other thing that's really important for us as a DFI is the ability to move quickly. And that gets to the complexity and the flexibility of DIB structures. And for us, we want to deploy capital now, especially in the context of COVID. And are there more simplified structures that we could use to be able to meet the market need today versus the longer, launch time that it's taken for the DIBs that we've worked on? And then finally, I just want to end on a positive note. I think there's a lot of opportunity, especially as it relates to healthcare and the delivery of healthcare. At the DFC, we've just launched a $4 billion effort to put funding in healthcare and prosperity across the globe, specifically in sub-Saharan Africa. And I think this is a real opportunity to look at how we can deploy some of that funding in DIBs to really meet some of the needs across the continent of sub-Saharan Africa and elsewhere in the globe as it comes to healthcare delivery, digital health, telemedicine, as well as building up the basic infrastructure in a lot of countries around healthcare. And I'll pause there. Thank you.
Thanks, Dia. And I think maybe we'll get back to some of these conversations about scale. And there's, I think we've had conversations already for a while about some of the streamlining and scaling and how to try to make these things simpler. But we have had quite a couple of questions come in sort of about adaptations and some of the things that Maya and Avnish that you mentioned in terms of needing to renegotiate targets. And so Maya, I want to put this question to you, and you talked about needing to potentially renegotiate targets, and so we have a question about how you're able to do that. What are the parameters? What are you learning as you're trying to do that? Are the parties, given how challenging it is often to come to an agreement about what the parameters are around a DIB, how some of those conversations are playing out, and whether there's an openness to that or an openness to, changing some of the objectives or lengthening timelines and things like that.
Sure, no, and that's a great question. And I think one of the benefits of these outcomes-based contracts is that they align incentives. So at the end of the day, the different stakeholders that are around the table all want to increase social outcomes. So they want ultimately for children to learn more. They want ultimately for quality standards in hospitals to improve. So whether that be on the outcome funding side that are usually governments or donors, what they want is to maximize that impact. And on the investor side, well, in our case, we're a socially minded investor, obviously as a foundation, but generally the way that the impact bond is set up is that there's an incentive for the investor to want to maximize those social returns because that links to financial returns. And obviously the implementers on the ground, that's their raison d'etre, is to improve outcomes for the beneficiaries. So in terms of one of the big benefits, I think, of impact bonds is that it requires and forces collaboration, dialogue, and coordination. And I would say that then also helps in terms of rethinking negotiation and rethinking the targets and renegotiating the targets, because ultimately what everybody around the table wants is to maximize that learning. So, I think certainly one thing that can be improved in terms of on the contracting side, and I think is a lesson learned for all of us, is that contingency planning should be built in more clearly right from the beginning in the design and the contracting itself, so that contingency planning doesn't need to happen in the case of a black swan like COVID, where we're thinking about that as we go, but rather that those different scenarios can be thought about in advance. That's, I think, a room for improvement. But in terms of how that renegotiation happens, we've been very pleasantly surprised at how willing the different stakeholders are to engage in finding the right solution that ultimately will benefit the most vulnerable populations that we're trying to reach. The other thing to note is also that, COVID is, as was mentioned, has by Charlotte and others, has exacerbated inequalities. The other thing that an impact bond contract can do is put incentives to make sure that we're reaching the most vulnerable populations. So I think that's another feature that I think can be a positive aspect of these types of structures in light of COVID.
Thanks. And Avnish, we had a couple questions come in for you. One about, just asking you to explain a little bit about how risks have been shifted. You mentioned that risks have been shifted, and so to get into that a little bit more. And also just a broader question about, isn't there a risk now that these outcomes aren't achievable, that these, DIBs, SIBs, et cetera, won't deliver on their promise? And so how do you then change the incentives or the terms? Or is there a risk that you might, for example, lower the bar because of the pandemic?
Yeah, absolutely. Thanks for that. And I think that risk of lowering the bar is very real. And to Maya's point, I think the one stakeholder who's often not at the table in these negotiations are the communities themselves, right? So you have the outcome payers, you have the investors, you have the service providers trying to renegotiate a deal. And oftentimes you can get to a place where incentives is not entirely aligned with impact, because more impact means more risk, less impact means less risk sometimes. So I think as the sort of brokers of these negotiations and trying to intermediate it, I think it's really important to establish very clear negotiation principles upfront that requires that in many ways the benefits and the impact of the beneficiary be the driving line of negotiation. Because if you think about orders of vulnerability, oftentimes the communities are the most vulnerable. Then you have service providers or investors who are perhaps a bit more exposed, and then you have the outcome payers. So we often tend to forget that last the most important group at the table, that who's often not at the table. So we've had really, to be honest, very tough negotiations, and we've had we've been lucky to have outcome payers who've really played their role, which is to say and recognize that yes, there's a crisis, but this crisis is actually requiring us to do more with less, not to do less with more, which oftentimes tends to be the goal of many renegotiations. So we've had very little flexibility, in fact, from outcome payers. They've only considered, none of them have lowered targets. We've made things more flexible, perhaps, for providers to be able to adapt strategies to a new environment. We've recognized results that are needed that were previously not needed. But it's really been important to maintain the integrity of the results and to keep the bar as high as it has been, recognizing that there is an added risk, but that's part of an outcomes payment contract, is that you're transferring risk, and when risk hits, well, you have to take it on, right? So I think we've actually been quite careful in not falling into the challenges of lowering the bar, quite the opposite. And in terms of risk shifting, I think that's been part of the game, right? It's trying to figure out what are the types of risk that the outcome payers that can absorb without at all jeopardizing the benefits and the welfare of the communities in a way that truly adapts to the crisis without really necessarily putting them at risk, right? So I'll just pause there in case you have follow-up questions. Feel free to go.
Thanks. Maitreyi, I wanted to turn to you. We had a couple of questions about sort of how you define outputs versus outcomes in what you were mentioning before, and whether you think donors will find this an acceptable approach to sort of make this shift. And I also wanted to ask you a question, because I think a key piece that we haven't touched on so much yet is the role of governments. And I know that as you have worked in the sort of RBF space, you've done a lot of work with governments, and that has been a way to also look at how do you scale some of these initiatives. And so wanted to get your take on those issues.
Thank you. I'm glad you asked the question about government. As far as the World Bank is concerned, our client is the sovereign government. So pretty much everything that we are doing is through the government. So the role of the government, as far as we are concerned, is key to two things. Okay, even if it is, even if the government is not an outcomes funder, okay, even if it's a private outcomes funder, even in that context, the enabling environment that the government puts in place, the systems of accountability and legitimacy that the government puts in place are central to the manner in which contracting takes place and the way in which contract laws in that country actually take on issues of risk, but then overall contracting. So the role of the government, both in terms of policy, but also in terms of the overall institutional environment, is absolutely key. You wouldn't be doing an impact bond in a country that didn't have a strong institutional structure. You couldn't do it because of the nature of the contracting arrangements just wouldn't hold. Okay, so that's one. The second thing, I want to give you this example of a new outcomes fund that is coming up in the state of Haryana in India, okay, where the government is the outcomes payer, and then there is a host of other agencies that are involved and outfits. In something like that, the government is the overarching education policy maker, the overall education policy implementer, and the results monitoring authority. That's at the highest level, at the policy level. And so it becomes really important to be able to see an impact bond, or to be able to see whether it's a development impact bond or a social impact bond in the context of the broader policy environment. And we had talked earlier about scale and about scaling up. When the government is an outcomes funder, such as in the case of Haryana, the chances that something like a development impact bond that the government is then holding accountable investors and service providers becomes part of policy is a very likely possibility, as opposed to when the government is completely out of the picture. So governments are, to me, I mean, it is central. And maybe it's because I work in the World Bank and we work with governments. Even for instance, our Uzbekistan project is a component in a broader education project that we are doing with the government. The Ghana project is additional financing to an overarching education project that we are doing. Way back when, I had designed the Employment Fund project in Nepal as the team lead there. And that was very much part of the government's overall structure. And then it basically went into the government's overall vocational education plan. So I cannot emphasize more the role of the government. And your first question was on outputs and outcomes, and I deliberately took the second question first. You know, and I'm quite fond of saying, depending on who you talk to a small NGO, something that a government may think is an output may be an outcome. So for instance, take the idea of learning, stick out of enrollment. To a large government program, enrollment is an output. It is actually a sine qua non of the next of the outcomes. If you don't have enrollment, you can't have learning outcomes. Learning outcomes, on the other hand, are outcomes. But as far as we're concerned, enrollment is that gray area between whether it's an output or an outcome, okay, depending on who you talk to. But a more clear example of what's an output and what's an outcome is what I mentioned in the water sector, for instance, in WASH. Giving people access to water points in the house, those water connections, is an output. But then to see what happens to that water, whether it enables more girls to go to school, it enables more women to go to work, whether it enables more people to, to have kids to have less diarrheal disease, all of that is outcome. But let me just say, attribution is a very, very problematic issue. Now, was the reduction in diarrheal disease because of an impact bond that focused on outcomes, or was it because of a host of other things that were in place because of which the diarrheal disease was reduced? So when we start talking about outcomes, all these issues become quite muddled. And so outputs in many ways are just easier to talk about, and outcomes for that reason are harder to both achieve and to be able to attribute. Let me stop there, Adva.
Thanks. Maya, I'm curious if you want to sort of weigh in on this outputs or outcomes discussion. I know you guys have thought a lot about sort of the importance of framing outcomes. And I did have another question for you also, because I saw the news recently that on not on the foundation side, but UBS Wealth Management Division said recently that sustainable investments were going to be the preferred solution for its clients, which was sort of a first of a big bank. And so one of the questions that I have is, as we're seeing this sort of growing momentum around sustainability investments, whether there is an opportunity there for outcomes products to be developed that can appeal to some of those investors. And I know it's a question I've asked of you guys before in the past, but I think we're seeing things evolve in the more traditional finance sector. And Dia, I might come to you on this question as well, because I know you guys are working with a lot of sort of traditional finance institutions as well. But I'll turn to you, Maya, first on this issue.
Well, thanks. So let me start on the kind of outcomes discussion and want to come back to Maitri's point that ultimately, you know, government is central to this. And I think the way that we've thought about outcomes-based funding is a way to be able to spend development funding more efficiently. And so basically trying to get funding to be actually focused on results, and that outcomes-based funding is a proxy for results. I think one of the challenges that I think the development community is facing sometimes is that we don't always know whether the funding that's being deployed is actually linked to results. And so clearly one of the main rationales for outcomes-based funding is for that funding to be more closely linked with measurable results, and for that ultimate payer to be the government or a donor, so that the funding that is being spent there is closely linked to those results rather than focused on activities. So rather than measuring the number of teachers that are being trained, actually looking at whether children are actually learning. That's at least the way that I think about or that we explain to our, let's say, lay audience, the difference between outputs and outcomes. Coming back to your question around the growing momentum for sustainable and impact investing, I think, and whether you know, we can build on that to try and appeal to a broader range of investors. So I think definitely, we're definitely seeing that there's a demand for such investments. Sustainable investing has been growing exponentially. It is now becoming the solution that UBS Wealth Management is recommending. We're seeing that ultra high net worth individuals, 82% of them are actually interested in sustainable and impact investing, but only 45% of them actually have those investments. So there's a gap between what they're interested in and how they're actually deploying their funding. UBS has seen double-digit growth in terms of impact and sustainable impact investing in 2020. So definitely huge momentum there. I think that does, you know, present an opportunity to actually tap into those investors that are interested in impact-linked finance, where, you know, outcomes-based funding are directly linking social outcomes with financial returns, and not only that, but they're linking it to areas that are particularly relevant post-COVID. So areas where impact bonds have had more experience have been education, health, and in the employment sectors. So I think there's a narrative around it. They're focusing on impact, and they're focusing on areas that are particularly relevant post-COVID. The other thing that I'll say on the demand side of things is that that is of interest, I think, to investors nowadays is that it is uncorrelated to other asset classes. It's uncorrelated to financial markets. It's correlated to the actual social outcomes. So that is also, I think, an additional area that is of interest. I think, how do we make them more appealing other than tapping into the demand? I think it's on the structural side, and coming back to what Dia was saying, scale and standardization will be key in order to get more mainstream investors to come on board. And one of the efforts that we've been working on is to try and put together a vehicle that would invest in a portfolio of impact bonds at much larger scale, focusing on key sectors and focusing on sectors that are typically, let's say, less easy to invest in. So that's also hopefully an attraction there. So looking at, getting that scale and standardization by creating a vehicle that is much larger in size, and blending different types of capital where you can leverage philanthropic capital as a way to then attract and crowd in more mainstream financing. So that's on the investment side, but there's obviously a bigger piece around building the entire ecosystem around outcomes-based funding, and we probably don't have time to go into that now, but we think as a foundation that's equally as important as well.
Great, and Dia, I'll come to you. We're running short on time, and I apologize. This is clearly a conversation that we could spend a lot more time on, and we've had more than 30 questions, which is incredible. And so I apologize to everyone listening if we haven't been able to get to all of your questions. It's clearly, this is an issue that we need to have more events and conversations about. So we'll be thinking about that and thinking about it in our coverage. But before we go to Phyllis for our closing remarks, I did want to do sort of a lightning round with all of you. We had a question come in that's sort of, a big picture as we look forward. How do you see this space evolving? Do you think we'll, reach some stagnation as people are maybe more risk averse or hesitant in response to COVID, or whether we'll see growth in the development of some of these new vehicles and tapping into this sort of increased demand? So Dia, why don't we start with you?
Sure. I would say my key takeaways and what I would emphasize as an investor is the focus on scale and simplicity. And I think those are going to be two key aspects of continuing to grow the DIB market. And I think it'll be very important as we look at all aspects of it, as we look at structure, partnerships, and also kind of the points that were raised on risk mitigation, and also the role of each party in taking risk. And just from my perspective as a DFI versus a purely private or more commercial investor. So scale, simplicity are the two key words I would end with.
Thanks. Avnish?
Yeah, thank you. So I think, looking forward, the real proof point for this ecosystem and this movement of outcomes-based financing, I think, is going to be around proving sort of mainstream and widespread government demand for results. It's something that I think deserves much more attention. Governments will demand outcomes-based financing when they are accountable for the results that we're proposing to achieve through them. And I think, we've spent a lot of time producing evidence and building capabilities. I think these are sort of necessary but not sufficient conditions for the mainstreaming of outcomes-based financing. For it to happen, I think we're going to have to work much more collaboratively with, the accountability and transparency ecosystems, open data, open government, to really try to strengthen the link between citizens and governments, and to make sure that citizens who are, the citizens who are with the weakest voice and the most underrepresented in the political process, those are the ones we tend to try to address for programs, that they are more included, that they can generate a durable sort of demand for outcomes. And I think if that's in place, a lot of the other things that we're talking about, like, scale, getting transaction costs down, will just follow through. So I'd really kind of want to see the next few years focus on seeking out these collaborations and getting transparency and accountability on the agenda of this ecosystem as well.
Wonderful. Maitreyi?
Very quickly. So I don't see the demand for this going away at all. What I do see is a huge amount of innovation coming in the instrument itself. And the kinds of innovation I'm sort of anticipating are innovations where the entire instrument, the whole transaction, is a blended one. So it's not just an outcomes, but it's a continuum between an outputs and an outcome, or jointly an output and an outcome transaction. And that builds in that flexibility, because the COVID days are not going away anytime soon. This is going to be our reality. And we are going to have to function. It's not like when we go back to normal, we'll be doing it differently. No, this is the normal. So this is the risk environment that we're going to have to deal with. And we will have school closures and hospital closures and mobility restrictions on an ongoing basis. How do we build that in? So I see a lot of adaptation and innovation coming into that. And the way I think about it is to think about the outcomes, the impact bond or an outcomes-based financing as a blended instrument itself. And that's the flexibility and simplicity argument as well, number one. Number two, I do see it being more successful where there's already an institutional strength where people have already done results-based financing of different kinds, where they're used to independent verification, data, different kinds of contracting. That's where I see it being much more successful. Finally, I see in terms of looking forward, a lot more investment in digital innovation. So a lot of digital innovation without which we are not going to be able to measure results and pay out. So those are the areas. And also I see a lot more in terms of the kinds of activities that will then lead to outcomes. I see those pivoting quite a bit as well. So I see a huge change coming, but the demand is not going to go.
Thanks, Maitreyi. And now it's my pleasure to turn things over to Phyllis Kurlander-Costanza, who is the head of UBS and Society and the CEO of the UBS Optimus Foundation, to give us some closing remarks. Thanks so much for being with us, Phyllis, and thanks for helping make this event happen as well.
Our pleasure. Well, thank you so much, Adva, and thanks also to Charlotte for her opening comments, and also for UNICEF's leadership role in really growing this landscape. It's been a great discussion, and as Adva said, I not only lead UBS Optimus Foundation as the CEO for the past 10 years, but also the sustainability efforts at UBS, and UBS is the largest global wealth manager. And right now that's important because companies are really being asked to step up and interact with society in ways that have never been demanded of them before. And a recent survey actually underscores this, that shows that 90% of people think it's time for a corporate reset to start thinking more about other stakeholders and to be much more engaged in problem solving. And as a finance institution, it's really great right now to be on the solution side of this crisis. And also we're in a unique position because we heard Charlotte say that the companies, the private sector hasn't stepped up the way we want to see them step up when it comes to achieving the Sustainable Development Goals. And for those of you who read the recent Gates Goalkeepers report, you'll know that tragically, we're sliding backwards. And so now more than ever, we need the private sector to step up and partner with governments and nonprofits and society to help address these SDGs at a critical time. And while this is still an emerging approach, we see outcomes-based financing growing as a tool in development finance. And we see from our clients at UBS that they're really interested in this space, especially now. And to be clear, we know that development impact bonds are not the only game in town, and they're not the silver bullet by any stretch of the imagination, but they are really an important tool to demonstrate how innovative financing models can help unlock diverse sources of funding and also deliver measurable impact on the ground. Because the number that you started with, Adva, when you said $2.5 trillion, that's the number we've been using for a while to identify what is the funding gap to achieve the SDGs. I suspect that number has grown, but it's also not just about the money, but it's about making sure that we're achieving actual outcomes. And development impact bonds are really targeted and they're scalable. And that's why we have been so committed and continue to be committed to help take them to the next level. And we do think that we are quite well positioned to do this. And we have clients around the globe who are increasingly interested. And I would say that the mindset of a development impact bond can be described as impactful, measurable, and efficient. And it really has three essential components. The first one is scale. And just as with successful businesses, philanthropy needs to get to scale if we want to have any chance of achieving real significant lasting impact. And philanthropists alone don't have the resources to do this. And we know that things like building individual schools and hospitals and institutions, while come from the best place, they will never achieve the scale that's required to address and solve the world's problems. The second thing is evidence, and learning from seasoned experts about what does and doesn't work is going to help us all ensure that we're not repeating the same mistakes. And these rely on really robust data. And then the final element is collaboration. And everybody talked about this in some way. And if the private sector is able to partner with the public sector, with individuals, with NGOs, bilaterals, then we can really catalyze our impact. And that's what we want to do. We want to multiply our impact. We want to hit above our weight in all of these things. We would like other financial institutions to step up and start competing on some of these, try coming up with some of the best innovative models to achieve real impact. So what does it look like going forward for us? We will continue to play an important role in this space, and COVID more than ever has really underscored the importance of this. And you can see some of the things that we've done right now. Maya talked about how we have now made sustainable investing our preferred solution for wealth management. So when a client walks in the door, we automatically recommend these sustainable investing solutions. And it's really big change in our philosophy at UBS. And also the Financial Times wrote, if anyone's still wondering if environmental, social, and governance investing is a passing fad, UBS made a landmark announcement yesterday that should put the issue to bed. And I really hope it puts this issue to bed. It can no longer be debated. This is, we need this for society, and consumers are demanding this. So I would just like to say thank you again. And it's been a real pleasure listening to this important discussion. And I hope that we can play an increasing role in this. We have plans coming out. Stay tuned for some innovative things that we're planning to do also, which addresses one of the points made about thinking of this not as a pure solution, but blending solutions. And we will have more to report on that in the coming weeks. So thank you again to Charlotte, UNICEF, and also back over to you, Adva.
Thanks so much. And thank you all for joining us today. I know we're a couple minutes over time, so I'll let everyone go. I'm sure it's a very busy week for everyone, but thank you to all our panelists. Thank you, Phyllis. Thank you, Charlotte. And looking forward to more discussions with you all in the future. Thanks to everyone who attended. Take care.
Thank you very much, Adva.